After the 1 trillion removal by 2012, another $500 billion will be removed by 2015. And that is not just an open pledge. That is something which the American industry is willing to be audited on. And there will be a formal audit by the Robert Johnson Foundation, which is one of their very big research organizations, to see that their pledge is being fulfilled. And if it is not fulfilled, there will be consequences. Don't rule out legislation. I had the good fortune to observe Michelle Obama announcing what she had in mind at the White House. And she, with a delicious smile on her face, but a velvet glove which hid an iron fist, said to the assembled company, and if they don't do it, we will hold their feet to the fire. And she meant it. And that was the clue for the Americans to say, here is a baby who really does mean business, and I believe that she is so. If the food industry does not come out of denial, there will be a result from her. But the second dramatic announcement was made by the deliciously slightly overweight US Surgeon General, who is the same as the Chief Medical Officer in this country, who has the fortune of being female, black, and from Alabama. And Alabama is the second fattest state in the United States, so she knows the problem at first hand. And she has come into the job like a firebrand. Michelle, you can look after the food industry. I am going to take on the advertising and marketing industry. I am up to there with what you are doing, marketing unhealthy and unwholesome food to our children, and that is going to stop. And she made this declaration at the World Health Assembly of the World Health Organization only last week, and we expect, certainly in the United States, to see that those are fulfilled. So what has happened here? In 2004, we made the same kind of feeling. We said to the food industry, reformulate yourselves, or by 2007, we will act. Come 2007, nothing happened. When Change for Life was first launched at the beginning of last year, we got the same words coming out of the Minister for Health, reformulate yourself or we will act. This time, industry gave the government £200 million over a 3-year period to help it with its Start for Life program. And essentially what industry was saying, we'll give you the money, you get off our back, we will regulate ourselves, just stay at arm's length. In America, they now know that self-regulation is not totally effective. In some instances it is, and I have to concede that there are a number of very large companies who actually have approached this problem, but in general they have not. And that is going to stop in America, and I would beseech the United Kingdom coalition government to do the same over here. I won't be talking about all the chapters in the book, but I will concentrate, in fact, on 2. And that is where Michelle Obama has made her biggest point. And her first recommendation of the 70 recommendations she has made starts with preconception. Preconception advice for women about to have a baby is something which we have never really properly considered over here, yet in America they have a game plan which actually spells out what should happen. She uses the phrase from menstruation to menarche, from menstruation, to the menopause. And she is saying that every woman in the United States of childbearing age should have advice, not nanny statism, but simple advice on what to do to get themselves in shape. If you ask any obstetrician gynecologist in this country, they will confirm that the #1 NHS issue surrounding maternity is the fact that we have got so many women going into pregnancy overweight and obese, and something has got to be done. It's got to be done not only for the women, it's got to be done for their prospective children, and certainly it is going to be done for the NHS, because the burden of having fat, obese mothers is absolutely threatening. When is it going to be happening? That is the difficulty. In America, they are now saying, we're back to school. And if you will, pointing the finger on the fact that we in this country have progressively cut from our school curricula any advice, any learning that our children can have about becoming parents, about cooking, about raising children. And we have a generation of people going out there who do not know any of these skills. That will change in the United States, and that hopefully will change over here. And I would believe that, in fact, that is very much uppermost in the minds of the medical advisors to the Department of Health. And I can reassure you of that, since I was meeting them yesterday, and they were just giving me every opportunity to be as controversial as I could be at this conference, because they want to see the issue debated rather than swept under the carpet. When we are talking about overweight and obese women, we are also talking about measuring them. Those of you who know me well will know that my life has been constructed around measurement and the fact that we don't use measurement to its full effect. What is going to happen, according to the Obama document, is that women are going to have their BMI taken at preconception advice, at entry into obesity, entry into pregnancy, excuse me, periodically through pregnancy, at birth, and then starting postpartum with a measurement at 6 weeks and then on, in order to reduce the woman back down to her preconception shape, would she be having a second child. That is unheard of in this country, because we threw it all away 10 years ago when it was decided that women did not need to be weighed during pregnancy because there was scans and all these other things which would tell about the outcome of the child. That, according to the American Obama document, has not worked, and they're going to go right back. They're looking at it. They're not saying that it should be across the board immediately, but they are doing proper prospective studies to prove that, in fact, it is worthwhile. And if it's just the mothers who are going to be measured, so are the children. In the United Kingdom, back in the 80s, for those of you who were alive in those days, we threw out any kind of proper monitoring of our children, and if you will, we deserve the obesity epidemic which we have now. We took our minds off measuring children. We failed to see the year-by-year insidious increase of child's weight. And suddenly in 2000, we leapt up and said, my God, we have an obesity problem because we have children in this country with a BMI of 50. And that is a national disgrace. It didn't happen overnight. It happened gradually, and we failed to look at it. So what the Obama document is saying is that every American child will be measured at every well-child session in order that the measurements of those children will inform the health authorities. Now, measurement by itself doesn't solve obesity, but what it does is allow the professionals to see and to monitor over time the insidious rise of weight and act at that time. Some of you might say, well, what do you act with? And I have to tell you that in 2003, the Chief Medical Officer for the United Kingdom wrote a document called the Obesity Time Bomb. And in 2003, he said, intervene at the correct time. Therefore, there must have been interventions around at that time. Now we have the benefit of more interventions which are available, and I hope that Paul Sacher will talk about one of the mainstream interventions, which is MEN program, and there are many other programs which you can now have resource to. And of course, interventions can be prescribed by general practitioners as well.